Do you know the truth about Alzheimer's? Are you falling for common misconceptions about Alzheimer's? Have you ever wondered if Alzheimer's can be prevented or reversed? Are you curious about the real causes behind the enigmatic disease? Join us as we unravel the mysteries and unveil the groundbreaking discoveries that could change the game. It is natural that Alzheimer's disease seems scary with the symptoms it causes, and currently the number of people suffering from it is increasing. It is estimated that the number of adults aged 65 and over will increase to 17% of the global population by 2050. Although medical innovations will arrive in the direction of prevention and treatment of Alzheimer's, but these figures help to take the dissemination of correct information more seriously. Despite the prevalence of this disease, there are many misconceptions about the symptoms and risks of Alzheimer's disease. Memory loss and Alzheimer's disease are part of aging. As we age, our brains and bodies change. It is normal to have problems with our memory sometimes, but Alzheimer's disease goes beyond the problems that sometimes happen to memory. Only elderly people get Alzheimer's. Although it is not common, but people in their 50s, 40s, or even 30s can develop Alzheimer's. An estimated 200,000 people younger than 65 are living with the onset of Alzheimer's symptoms. Even if you are diagnosed with Alzheimer's, you can still live a quality life. According to the Centers for Disease Control and Prevention, 80% of Alzheimer's care can be done at home. If your father or mother got Alzheimer's, you will get it too. Having a biological father or mother with Alzheimer's does not mean that their children will also get Alzheimer's. Other factors beyond genetics play a role in Alzheimer's disease. Environmental factors also affect the possibility of Alzheimer's disease. Although we still do not know how to prevent Alzheimer's disease, but of course, healthy habits such as exercising regularly and having a healthy diet play a role in this. People with Alzheimer's do not know what is going on around them. A person with Alzheimer's may easily become distracted and forgetful, but he is usually aware of his surroundings. Remember, never talk about it in front of the patient or assume that he does not understand what you're saying. In the way you communicate with the person who has Alzheimer's, try to use simple language and give them more time to respond. Correct his mistakes in the form of suggestions, and your words and behavior are not reprehensible. Alzheimer's diagnosis means life is over and a treatment center is needed. Even if you are diagnosed with Alzheimer's, you can still live a quality life. According to the Centers for Disease Control and Prevention, 80% of Alzheimer's care can be done at home. People living with dementia can still plan their lives, set goals, and discover and experience new hobbies. Prescription drugs for Alzheimer's can treat this disease. The current drugs prescribed for Alzheimer's patients can at best slow the progression of the disease. These drugs actually temporarily, not permanently, improve symptoms. Current Alzheimer's drugs allow a series of neurotransmitters and hormones in the brain to degrade more slowly, thereby increasing levels of these substances in the brain. Prescription drugs can help control some of the common symptoms associated with Alzheimer's, such as helping nerve cell signaling, but they do not eliminate the disease. Forgetting names is one of the main symptoms of Alzheimer's. When a young person forgets the name of a famous actor or can't remember why they walked into a room, it doesn't mean they have Alzheimer's. The fact is that Alzheimer's causes major disturbances in daily life and affects thoughts and decision-making power, and etc. Remembering where you put something has nothing to do with Alzheimer's. But if, for example, you have a car switch in your hand and you don't know how to use it or what it is for, this is not normal. Dementia cannot be prevented. New research shows that having a healthy diet, regular exercise, not smoking, and doing activities that stimulate brain perception and cognition can reduce the risk of dementia. Of course, you should start these lifestyle changes from a young age, not wait until you are 70 years old. Mediterranean diet can affect the possibility of dementia. High levels of antioxidants in fruits and vegetables may prevent some of the brain cell damage that leads to Alzheimer's disease and increase levels of protective proteins in brain cells. The inflammation that occurs in the brain is the cause of Alzheimer's disease. Scientists say that the Mediterranean diet can reduce the symptoms of this inflammation while lowering blood cholesterol. New research shows that high blood cholesterol can be related to memory loss and intellectual problems. For most people, adopting a Mediterranean diet is a good way to have a healthy diet that plays an important role in maintaining brain health and function. Curious minds, join our Alzheimer's exploration. Subscribe for an enlightening journey. Give a thumbs up to challenge perceptions. Share your thoughts below, questions, insights, or experiences. Let's build a supportive community and navigate the complexities of Alzheimer's together. Uncover the truths beneath the surface with us.